Hello and welcome to our presentation on Croup. We're going to talk about its etiology, identification, and therapy. And this is done by Bahar Nadiri, Jessica Wadsworth, and Jared Scott. We thought a good way to present the material to help you learn about Croup would be to go through the questions that we had researched and formulated for multiple choice questions. So let's go through those and we'll talk about these different topics of Croup to help you assess it and treat it. So first of all, what is the most common group that you're going to find Croup in? And that would be infants and children. You can definitely see it in these other groups, but it's very rare, and so you're most often going to see it in infants and children. What's the most common type of Croup? That would be viral. You can also see it in bacterial, fungal, allergies, and inhaled irritants, but also those are not as common. So viral is going to be the most common type. And then what is Croup in general? It's swelling inside the throat, and it involves the upper respiratory tract. These other things that are listed here, as it talks about in the feedback there, they deal with the lower respiratory tract. And then here in the feedback it says Croup is a generic term encompassing a heterogeneous group of illnesses affecting the larynx, trachea, and bronchi. Laryngotracheitis, laryngotracheobronchitis, laryngotracheobronchopneumonitis, and spasmodic Croup are included in the Croup syndrome. So Croup, like it says here, encompasses a few of these different things. What's the classic symptom of Croup? Let's say you have a child that comes in coughing and it kind of has a barking quality to it. Well, then you're immediately going to be thinking of Croup. But anytime a child comes in and they have a severe cough, also on your differential diagnosis, you're going to have epiglottitis there. But it's more defined as a hot potato voice. And if you remember, Miss Reyes did an expert job of demonstrating that for us. So Croup, the classic symptom is a barking cough. So be thinking about that too for a test or for the pants. If it says cough and it has bark somewhere in the description, think Croup. So then how do we treat it? What's the most common treatment for Croup? And that would be a single dose of oral steroids. These other things aren't going to be effective. For decades, as it says here, epinephrine has been used, but they've done studies and statistics have shown that the glucocorticoids such as dexamethasone are associated with shorter hospital stays, improvement in Croup scores, and less use of epinephrine. So that's being used more, and epinephrine is being used less. And also, for hundreds of years, at least 100, mist therapy, humidified air has been tried, and even hospitals have used that for a long time, and it's being used less and less because that's also showing to not be very effective. So the glucocorticoids, oral steroids are the most effective treatment. And then definitely what you're going to need to do is pay attention and have effective airway management for a child. That's paramount, so you need to be looking at that to help a child be able to breathe. Let's move on. We have when are the symptoms of Croup often the worst? And that would be at night or when the child is crying or aggravated, and that's going to heighten those coughing symptoms and make them worse. So here's a case study, and you can pause it and read through it, but it basically talks about the mother brings in a child, says that the cough resembles a bark. It's worse as the child's going to bed. So as we already talked about, it's a child, a barking cough, worse at night. Well, then you can identify that as Croup and rule out these other things, although they could have comorbidities. But for example, in this question, the answer is Croup. And then we talked about it also as well. Croup is an obstruction of what? And that would be the upper respiratory tract. And here's another thing that goes along with Croup is how you identify it on X-ray. But if you are looking for, only half of the patients that are diagnosed with Croup are going to have this finding, and that is a positive steeple sign. And if you see here where the arrow's pointing to, you see this point, it resembles a church steeple if it comes up to a point. And here's a couple other examples of that. And what that is it's a result of a narrowed column of subglottic air, and it's seen on posterior anterior view and an overdistended hypopharynx on the lateral view. So if you do an x-ray and you see that point, that's the positive steeple sign for croup. And then which of the following is an indication that a patient presenting with croup needs to be hospitalized? Definitely if they're cyanotic, then that's a sign that they need to be hospitalized. A barking cough, wheezing, or a fever aren't necessarily indicative of hospitalization. Obviously, if it's a very, very high fever, you're going to want to help someone out, which may involve hospitalizing them, at least checking them for a couple hours if in the urgent care or the ER. But as opposed to flushed face, pallor would be a call for hospitalization. But in this question here, cyanosis wins the day. So that's the answer here. Hope you learned something and are a little more educated on croup. And here's our sources that we used. Thank you very much.